Ladies and gentlemen, my name is Associate Professor Kong Kam. I am the current President of Thai Association for Gastrointestinal Endoscopy. Today is 25th February 2020. Today, we are honored to have Professor Zhen Ding from Wuhan Union Hospital to give us a lecture under the topic of gut feeling from Wuhan. We have a great honor having him present his presentation regarding management of endoscopy units in a setting of outbreak of the virus in Wuhan. So please welcome Professor Ding Zhen. The presentation aims to distribute knowledge about management of endoscopy units during the outbreak of the virus. We anticipate that audience will learn how to cope with the virus outbreak from lessons from Wuhan Hospital.
Thank you so much and good morning everybody. I'm Zhen Ding from Wuhan Union Hospital. Thanks for Professor Kong Kam's invitation to take this special lecture. We all know the COVID-19 virus outbreak in China recently, and it's my pleasure to introduce some information here. And these are Chinese epidemic maps. The left figure is Chinese, and the Hubei province locates in the middle of China. And the Wuhan city is the capital of the Hubei province, and is the most severe involved in this crisis. Here now, more than 40,000 people get infected in Wuhan. Next. How to diagnose this kind of infection? First, we can see this table. This table describes the symptom of this kind of infection. And the fever is the most common symptom in this kind of infection. It occurs in more than 98% cases. And the fatigue is the second common. And it present near 70%. Besides this, in my experience, some patients only present with sometimes the patients only have the digestive symptoms, including diarrhea, nausea, and vomiting. So it should be noted by the gastroenterologist. Next slide. Okay. So this is the routine blood test, and the left figure show the relation between the white blood cell count and the times, and the blue line represent the survivals, and the orange line represent the lung survivals. And we can see in the early stage or milder cases, the white blood cell should be normal. Sometimes it can increase, and this kind of increase often indicates the co-infection with bacteria. And the right figure is the lymphocyte count. And we can see in almost all cases, the lymphocytes decrease. And the less of lymphocytes, the more severe of the disease. And this trend is a kind of remarkable feature of this kind of infection. Next. The CT scan, we can see the CT in the CT image. The feature of the image is the ground glass opacity, and often it starts from the outer margin in the lower lobe of the lungs, one side or both sides. And in the end, it can extend to the whole lungs. And just like this. Next. Okay, the first is the nucleic acid detection from pharyngeal samples. And the positive result can confirm the diagnosis. However, the positive rate is not very high, so negative result cannot exclude the diagnosis. Okay, next. And so the infection can be diagnosed in two steps. The first is the suspected diagnosis. It means a patient, if you have the contact history, he have two of these three items: traditional symptoms, decrease the lymphocyte, and changes on CT image. If the patient have low contact history, all three items are needed. And the confirmed diagnosis is the suspected diagnosis. This is plus the virological evidence. This evidence includes the nucleic acid detection and IgM antibody in the blood. Next, after diagnose the COVID-19 infection, I think we want concern how much risk to the endoscopic staff. We believe the risk is very high. First, the virus may locate in GI tract. The proof include Chinese researchers have isolated liver virus from the patient's stool. And ACE2, this is a receptor of the coronavirus in the human cells. Actually, is a bridge connect from the virus to the humans. It can express in the GI tract. Next, like this image shows the picture. The receptor can expressed in the intestinal mucosa. Whatever, the virus can spread by the breath and close contact. So in the procedure, the staff might be infected by inhalation of virus and touch the splashes and other contamination. So endoscopy units staff are at high risk of transmission. Next. How to minimize the risk? I try to answer this question from four aspects: the patient screening, staff protection, endoscopy room disinfection, and the material management. Next, and to patient screening, at the beginning, the CSGE suggests the routine endoscopy procedure should be posed, and the procedure can only be performed in emergent case, such as GI bleeding, foreign body in the GI tract, obstructed jaundice with infection, biliary acute pancreatitis, and feeding tube placement. And before the procedure, the patient should get the temperature checking and ask the contact history and the respiratory symptoms. And the right table is the standard investigation form for contact history. Next. And in Wuhan is a little special because almost all people have potential contact history, and in some patients, the symptom is not obvious. So before the procedure, all patients should get the temperature checking, routine blood test, and the CT scan. And if the patient have no suspected infection, they can go to endoscopy room for the procedure. Otherwise, we have to move the patient to the negative pressure room for the procedure. Next. Okay, how to protect the endoscope? No. One. Yeah. How to protect the endoscopic staff? Before the procedure, all the staff should check themselves, just like a patient, the symptom or contact history. If everything is okay, they can go to work for the procedure. Otherwise, they have to get the isolation and the treatment. Next, in the procedure, if the patient have low infection, the level 2 protection is proper, is necessary. If the patient have infection, the level 3 protection is needed. Next one. These are different levels of protection. Level 1 protection means the staff have medical cap, mask, gloves, and working clothes. The level 2 protection is level 1 plus the medical protection clothes. eye shield should cover. And the level 3 is level 2 plus the mask respirator, and the double gloves is better. Next one. In summary, we should cover our body surface as much as possible. Like these pictures. The first one is in the appointment staff. The second one is in the outpatient center, and the right one is in the procedure. Next one. After procedure, all staff should disinfect body surface because it may contact the contaminants. Especially the wash hands is very, very important. And the COVID-19 virus is very sensitive to the ethanol, nitrogen peroxide, and hydrochloride. So, disinfectants should contain one of these active ingredients. Because of long incubation time of this kind of infection, so after procedure, the patient should get following for 2 weeks. In this period, if the infection is diagnosed, all close contact staff should get the isolation for 2 weeks. And the endoscopy room in this period, a fixed single operation room is used in the procedure. And to some infectious case, the negative pressure room is the best. At least we need a fixed isolation single room with the good ventilation. After the procedure, we have to disinfect all surface of the room and the equipment. And UV irradiation and ozone treatment are recommended for air cleaning and sterilization. We should keep all material in the good order. And all waste after procedure, all waste should be placed in the bag, and the bag should be sealed and labeled clearly. In some time, we have to move endoscope to other departments for the procedure. For example, in intensive care unit. In this situation, we used to cover the machine and endoscope with disposable film. And after procedure, we can discard the film. Okay, this is what we do in this crisis. Next. And what our government do is much powerful. And for example, we built 2 hospitals with 2,500 beds in 10 days. And I was touched by Chinese medical staff because they are very, very brave. From last 21st, the first medical team was sent to Wuhan. In fact, everyone knows how dangerous the job is. And this picture shows a doctor is saying goodbye to his wife. I think their expression can display everything. Actually, a lot of my friends text me before their medical team leaving. And the meaning is similar. All the supplies are free for you to use. If needed, we can send more. However, our medical personnel are only for rental. We still want them back from head to toe. Next. In this world, the medical staff might lose. Next. Yeah. Because they want to let their head to against the cap tightly and the strength for long time working. And next, even life. And until now, more than 3,000 medical staff are infected by the virus, and near 15 sacrificed their lives. Next. And even this, many more and more staff signed the application to join this war. Next. And till now, a lot of medical staff have been sent to Hubei province. And more than 30,000 medical staff. And add local medical staff, the total number is beyond 500,000. Next. So because of our union, our braveness, our spirit, I do believe our victory is coming. Nothing can stop us. Thank you.
Thank you very much.
Last slide is because Professor Kongkam asked me to, near the 15 medical staff have passed away, and Professor Kongkam asked me to connect their picture, and I try to find some of them. These are our heroes.
Professor Ding, you can't see us, but we're all standing for you and the people of Wuhan, and we thank you for all your efforts and what you're doing, and we wish you all the best and hope to see you all very soon and healthy, of course, as well. And again, I think this is very impressive because we are all standing for you and the people of China and the people of Wuhan. Thank you so much.
Thank you.
So may I ask our translator to read some Chinese language, please?
各位观众，大家好。本人在此代表白登财空康副教授以及代表泰国肠胃内窥镜协会于2020年2月25号，本人与泰国肠胃的内窥镜协会管理委员会对中国医疗人员团队及中国人民表示赞美和鼓励，特别是身在武汉市对抗新型冠状病毒的人士，我们对中国医疗团队在此战役过程中的最高效力和努力表示最高的敬意。如果没有如此高效的工作的话，情况可能会变得更加危机，也可能会影响到全球。泰国肠胃内窥镜协会对各位的无私奉献表示尊重，并且对在本次危机中而离世的每位医生、医疗人员及中国民众表示深切的哀悼。在此，泰国肠胃内窥镜协会会以准备就绪愿与中国和世界各国合作，共同以最快、最有效以及最低死亡率为解决此次的危机。我们对于本次疫情而牺牲的人士及正在一线工作的人员表示最高的敬意。本人代表在此会的观众，对在这一次危机中离世的医疗人员默哀1分钟。
So I am Associate Professor Padam Chai Kongkam. Today on the 25th of February 2020, on behalf of the Thai Association for GI Endoscopy, the TAGE committee and I would like to express our utmost respect for all of the GI endoscopy teams, doctors and medical staff members and Chinese citizens, especially
from Wuhan for fighting the coronavirus or COVID-19. We are deeply impressed by the highly active and effective collaboration amongst the medical teams. Without such optimum efficiency, the situation could have dramatically deteriorated and may have even more disastrous effects up in the world. War demands sacrifice of the people. TAGE, the Thai Association for Gastrointestinal Endoscopy, would like to express our deepest condolences to the families of the gastroenterologists, doctors, medical staff members, and Chinese people who passed away during these crises. We greatly respect for the sacrifices of the deceased, and we would like to declare that TAGE is more than willing to collaborate with China and the world on easing the situation as efficiently as possible and with the least damage possible. We also hold the hard-working staff and their families in considerable respect. And in remembrance of the dedicated staff members who lost their life during this grave crisis, we all would like to ask all of you in the meeting and anyone who is watching or listening to this broadcasting to kindly stand up for 1 minute, silence for their dedication and sacrifice, having worked at frontline in the difficult circumstances. Thank you. We are all strong together.
So thank you very much for this very impressive impression you gave us of the situation in your hospital and in your environment. I'm shocked to see that so many of our colleagues and of course friends of medical friends that have deceased in the last period, and this is something that I think that has a huge effect on all of us. Not only here behind the table, but also here in the audience. Well, we respect everything what's being done, and of course we are more than happy also to assist and help wherever we can, mentally or maybe in other way, to make sure that we will fight this terrible virus.